Gaza continues to be under Israel's complete siege, and the Strip's medical system desperately needs help. Hospitals are overcrowded, running low on medical supplies and fuel, and can barely maintain operations. The United Nations Agency for the Relief of Palestinian Refugees warns that it will be forced to stop operations as they run out of fuel. Humanitarian aid has been trickling into the enclave over the past few days. Now, just over 50 trucks have so far been allowed in since Saturday. The UN has said the 2.3 million people in Gaza need about 100 trucks of aid a day. Humanitarian Affairs Manager from humanitarian organisation Doctors Without Borders, Frederieke van Dongen, joins us from Jerusalem to get to the point. Frederieke, your team is currently in Gaza providing medical aid. Describe to us what they are telling you about the current situation there.
Over the last 2 weeks, they've been describing the situation as catastrophic, but the messages I received this morning all included the word hell. As you know, the Israeli government ordered people to evacuate to the south, but even the colleagues that are in the south said that for the last 3 days, the bombardments are more intense and frequent than ever before. A few of our Palestinian colleagues were brave enough to risk their own lives to stay behind in the north, to try to save as many lives as possible. But they're really working under impossible circumstances. Every few hours, there's the new news of another health facility shutting down, either due to the damage sustained in the bombardments or due to lack of power and supplies. To give you an example, some of our colleagues are still working in Shifa Hospital. This is the biggest hospital. It has a capacity to provide care for 700 patients. At this moment, they're treating over 5,000 patients. And at the same time, 45,000 people are seeking shelter there because they were displaced from their homes. There's a shortage of medicines, of medical supplies, of staff. 2 weeks ago already the hospital beds were full. They're out of anesthetics and painkillers. So at this moment, doctors are forced to perform surgery and amputations without anesthetics or any painkillers. So our colleagues share that they hear people, children scream of the pain. And 70% of the people who have been killed so far, but also 70% of the people injured are women and children. Fuel is expected to run out this evening. This is in about 12 hours from now. This means that the lights will go out in Gaza. There will be no transport. There will be no communication. But what this also means for the thousands of patients in the hospital who are directly dependent for their survival on electricity, this will be a death sentence. And this includes the 130 babies in incubators. But what is important to understand that this is not something that is about to happen by the end of today, but this is something that is happening already now. Doctors already are forced to, in some of the hospitals, they had to shut down the incubators of the premature babies that are in a critical condition to save the ones that have a better chance of survival. And not just for the babies in incubators, this is also for other patients. Doctors have to make the decision who they can save. And all of this, so of course, they're completely overwhelmed. These are impossible decisions to make, and they're all working under, with at the same time having the fear that at any moment, while trying to save lives, a bomb could drop on their workplace.
Frederieke, 8 trucks have finally been allowed into Gaza, but many humanitarian organizations are saying this is not close to being enough. How far off are we from meeting the needs of the people in Gaza, and what do they need?
Well, to compare the aid that was imported before the war, the estimation is that on a daily basis, 200 trucks of humanitarian aid were imported. There were 73 trucks per day with human food, and on a daily basis and on a monthly basis, 48 truckloads of medical supplies. So what is imported right now? cannot even be compared to the situation in normal non-war times. In addition to that, the needs are much higher because there's already a siege of 2.5 weeks now. So they need to compensate for those 2.5 weeks. And the needs are much higher because there's over 16,000 people who are injured who need medical care. And there's at least 1.4 million people displaced. As the moment that you have to leave your house, you're completely dependent on aid for your survival. And one of the most concerning things is that fuel is not allowed to be imported. Even if enough humanitarian aid would be imported, how is the aid going to reach the places without fuel? And how is it going to be distributed when nowhere in Gaza is safe? And how is medical care going to be provided if there's no protection for medical facilities or medical staff?
The United Nations, Arab nations, and European leaders are all calling for a pause to the violence so that humanitarian aid can reach the people in Gaza, like you mentioned, Frederieke. Will this help, and what more can governments, or indeed just any person who wants to help, do to aid the situation?
The international community has been falling short to stop the unfolding catastrophe in Gaza. What is happening in Gaza is really unprecedented, and the international community must unite and treat it as the unprecedented catastrophe as it is. As Doctors Without Borders, we call on governments for an immediate ceasefire to allow the access of humanitarian aid and the treatment of the wounded and sick and safety of civilians. We don't just want a humanitarian ceasefire, we want a ceasefire also protecting the civilians from the indiscriminate bombardments. Also, the siege needs to be lifted immediately. Israel needs to allow the import of water, food, electricity, and fuel. There needs to be free and safe passage for humanitarian and medical aid and staff into Gaza. And there needs to be an immediate protection for the medical facilities and staff. Of course, we're already preparing for the moment that we're preparing an emergency response when we will be able to enter Gaza again. But when preparing for this, one of our Palestinian doctors, he was asking the question, do you think there will be anybody left to help?